So imagine walking into a really pristine, high-end medical clinic, right? You sit down in the practitioner's chair, the bright lights are overhead, and you look them dead in the eye and ask them to inject fish DNA directly into your face.
I mean, on the surface, it sounds completely bizarre. It sounds like some weird science fiction concept or, I don't know, a viral social media prank that just got entirely out of hand.
Yeah, exactly. It's so counterintuitive to everything we usually associate with sterile, highly synthesized modern skincare. We were conditioned to expect these lab-created compounds, not marine biology in a syringe.
Right. But this isn't a prank at all. It is currently the single biggest trend dominating the regenerative aesthetics world right now.
Oh, yeah. You've probably seen the clickbait headlines or the celebrity interviews just raving about the salmon sperm facial. But, as a curious learner, you're likely listening to this because you want to cut through all that sensationalized hype.
You want to know what's actually happening at a cellular level?
Exactly. So the mission of this deep dive is to decode what these injections actually do. But critically, we are going to unpack a massive, glaring contradiction we found in the medical guidance.
And it is a huge contradiction.
It really is.
Hmm.
Because if this treatment is literally derived from fish, is it actually safe for patients with fish allergies?
Which is the absolute definition of diagnostic muddy waters. The clinical literature and the practitioners themselves are entirely split on how to handle that risk.
So to get to the bottom of it, we pulled together a massive stack of sources for you. We're looking at official clinic guidelines, dermatological deep dives, and, interviews with expert aesthetic practitioners like Dr. Soni and Dr. Charlson.
It's a lot of ground to cover.
Yeah, so let's unpack this, starting with the foundational science. The viral marketing calls it salmon sperm, but the medical term we found across all our sources is polynucleotides.
Right. Sometimes you'll see it abbreviated as PN or PDRN.
So what actually is it?
Well, to understand polynucleotides, we have to zoom way in, like down past the tissue, past the cells, right to the molecular level. They are highly purified, fragmented chains of DNA.
Okay, DNA chains. How big are we talking?
Structurally, these fragments are typically between like 50 to 2,000 base pairs in length. Think of base pairs as the individual rungs on the twisted ladder of a DNA molecule.
Got it. And the source of these fragments?
This is the wild part. It's the gonads, or the sperm, of Pacific or Atlantic salmon and trout. Specifically, species like Oncorhynchus mykiss or Kita.
Which is just wild to think about. But going through the historical context in our stack, aesthetic medicine didn't just invent this out of nowhere, right?
No, not at all. This is actually a very mature compound.
Yeah, it's been utilized in regenerative medicine for severe wound healing since, like, 1986. They've used it for tissue repair in burn units or for diabetic ulcers.
Exactly. The cosmetic industry basically observed that profound healing capability and adapted it for anti-aging, which makes perfect biological sense when you look at what the compound actually does.
Right, but the obvious question, the one everyone asks when they hear about this, is why fish? Out of all the biological material in the animal kingdom, why salmon and trout DNA?
It all comes down to a concept called homology. Basically, salmon DNA has an incredibly high degree of structural similarity with human DNA.
Really? How similar?
Depending on the specific analysis we looked at, that compatibility is estimated to be anywhere from 70% up to 95% similar to our own genetic material.
Wow, 95%. That's huge.
It is, and what's fascinating is the molecular biology behind that homology. Because of this, structural mirror effect, human tissue receptors do not immediately flag these marine DNA fragments as foreign invaders.
So it doesn't trigger an immune attack.
Right. Instead of launching an immediate defense, the human cellular receptors actually recognize and interact with the salmon-derived polynucleotides in clinically meaningful ways.
Okay, let me try an analogy here to map that interaction out because I think comparing it to traditional treatments is vital for you to picture this.
Go for it.
So if we think about standard dermal fillers, like the hyaluronic acid everyone knows, that basically functions like cosmetic spackle.
Yeah, that's a good way to put it.
Right. It fills a physical void. It takes up space under the skin to push up a wrinkle or add volume to a hollow cheek. And it just sits there until it dissolves.
Passive volume.
Exactly. But polynucleotides seem to operate more like a construction foreman. You inject them, and they literally hand the surrounding skin cells a genetic blueprint, actively signaling the body to rebuild its own structural foundation.
That is exactly how the clinical texts describe it. They explicitly classify polynucleotides as biostimulators for that very reason. They interact directly with fibroblast cells.
And fibroblasts are the cells that make collagen, right?
Yes, they are the cellular factories in your skin responsible for producing collagen and elastin. When these fragmented DNA chains are injected, they bind to specific purinergic receptor pathways on those fibroblasts.
Basically turning the factory on.
Exactly. They switch on the skin's endogenous regenerative biology from within, forcing that factory into overdrive.
And reading through the clinical outcomes, it's not just collagen production, is it? The cascade of cellular effects is massive.
Oh, it's huge.
The sources detail how polynucleotides promote angiogenesis, which is the formation of new blood vessels.
Yeah.
That improves local blood flow and overall tissue oxygenation.
Yeah, and they also have a profound hydrating effect. The molecular structure of the DNA chains actually attracts and binds water molecules deep within the dermis.
That's incredible.
And beyond hydration, they act as powerful antioxidants. The biochemical structure allows them to scavenge free radicals, those unstable molecules that cause cellular damage, while simultaneously reducing inflammation at a genetic level.
Which totally explains why the clinical guidelines list this treatment for such a wide array of issues. I mean, we saw it recommended for fine lines, deep acne scarring, dark under-eye circles, hyperpigmentation, rosacea.
Even injected into the scalp for hair loss.
Right. It is a fundamental cellular repair kit rather than just localized camouflage.
Yeah, it's a major shift from treating the symptom, like the wrinkle, to treating the underlying cellular decline that caused the wrinkle in the first place.
But, okay, if we're relying heavily on marine DNA to integrate seamlessly with human cells and trigger this massive regenerative cascade, that introduces a glaring physiological contradiction.
The big one.
Yeah. What happens when a human body's immune system is explicitly hardwired to actively reject and attack marine life?
Which brings us to the great fish allergy dilemma that's just dominating the medical literature right now.
Here's where it gets really interesting, because the clinical community seems completely fractured on this issue. We poured through dozens of clinic protocols, and the divide is just staggering.
It really is night and day.
On one side, you have official product guidelines from the manufacturers, like Plynist, which is one of the leading CE-marked polynucleotide brands. They explicitly state in their medical consent forms, do not use on anyone with a fish allergy.
They list it as an absolute non-negotiable contraindication.
Right. And yet, turn to the other side of the literature, and you find highly respected aesthetic doctors operating with an entirely different set of rules.
Like Dr. Charlson.
Yes, Dr. Charlson is quoted in our sources stating there is no clinical evidence showing polynucleotides trigger fish allergies. He calls allergic reactions almost unheard of.
And Dr. Sani echoes that exact sentiment. He noted that he uses the brand Amila and hasn't experienced a single case of an allergic reaction in his clinic, even when treating patients with known fish allergies.
So we have to figure out how both of these realities can exist simultaneously. Plynus says absolutely not. Dr. Somebody says it's perfectly fine.
Well, to solve the contradiction, we have to look at the mechanics of how allergies actually function.
Okay, break that down for us.
So allergic reactions, specifically food allergies like a severe seafood allergy, are triggered by proteins. When a person with a fish allergy eats salmon, their immune system recognizes specific fish proteins as a dangerous pathogen.
Right, and that triggers the attack.
Exactly. The immune system launches a massive attack, releasing histamine and causing the classic allergic cascade. But the proteins are the trigger. The DNA itself is not the trigger.
Ah, okay. The DNA is not the trigger. That is the crucial distinction.
Yes. Now look at the manufacturing process of these injectable polynucleotides. Companies like Mastelli, who manufacture the Plynist and newest brands, use a highly complex, patented purification process.
Right, I read about this. They use enzymatic digestion.
Basically molecular scissors. They use it to break down unwanted biological material, followed by precipitation and extreme filtration. The explicit goal is to strip away all the proteins, all the lipids, and all the cellular debris from the raw marine material.
Leaving only the highly purified, sterile nucleotide chains.
Exactly. And because the allergenic proteins have been systematically removed, the antigen that usually triggers the immune system's alarm bells is theoretically completely absent.
Which is the exact logic Dr. Soni points out. Because it is purely extracted DNA, there's no allergenic fish product remaining in the vial.
Right, that's the theory.
But I have to push back on that theoretical purity, though. I mean, if the proteins are entirely gone and it's just a sterile DNA chain, why do half of our clinical sources still demand patients sign specialized waivers?
Well,
Or flat out refuse to treat them? Like, if the antigen is eradicated, why is it still listed as an absolute contraindication by prominent clinics across London, Manchester, and Birmingham?
This raises an important question, and the answer lies in the vast gap between laboratory theory and real-world clinical liability.
Oh, liability.
Yeah. In theory, the risk is zero. In medical reality, the risk is never absolute zero. Purification processes, no matter how rigorous, are subject to the detection limits of our testing assays.
Meaning, even with pharmaceutical-grade enzymatic digestion, the most cautious medical boards operate on the assumption that a microscopic, undetectable trace of protein could, theoretically, survive the filtration process.
Exactly. And medical professionals have to differentiate between a mild seafood sensitivity and severe IgE-mediated anaphylaxis.
Right.
If a patient gets like mild gastrointestinal discomfort or a slightly itchy throat from eating too much tuna, that's an intolerance. But if a patient's airway aggressively closes because they were simply in the same room where salmon was being cooked.
That is a severe IgE-mediated immune response.
Exactly. And for that second patient, even the theoretical possibility of a microscopic protein trace surviving the purification process could be catastrophic.
Which totally makes sense. The London PRP clinic source actually navigates this distinction perfectly. Their guidelines state that because of the highly purified nature of the DNA fragments, the vast majority of patients with a mild fish allergy can safely receive the treatment.
But a severe, true Ig-mediated allergy with a history of anaphylaxis remains an absolute contraindication.
Because responsible clinics simply will not take the risk of triggering a systemic immune crisis for an elective cosmetic procedure.
Right. It's just not worth it.
So for you listening, if you have a mild sensitivity to seafood, but you're looking at the clinical data on neocletogenesis and want to try this treatment for, say, severe acne scarring, how do you actually navigate this safely?
It requires a highly structured medical approach. You really have to abandon the casual inject-and-go mentality.
And Dr. Soni outlines a very specific methodology for this exact scenario, right?
Yes. If a patient discloses a mild fish allergy during the consultation, he hits pause on the standard protocol. He does not proceed with injecting the product into the delicate, highly vascular tissue around the eyes.
He utilizes a patch cast solution instead.
Exactly. He takes a small amount of the polynucleotide gel and performs a superficial test on the patient's forearm.
And then the crucial observation period begins. He actually keeps the patient in the clinic under medical supervision for a full hour to monitor for any immediate localized or systemic reactions.
And if there is no immediate histamine response, he sends them home, but he provides a direct emergency contact number in case any delayed inflammatory issues arise over the next 48 hours.
Wow, that's thorough.
It has to be. Only if that forearm patch test remains completely clear for several days will he bring the patient back to proceed with the actual facial injections.
It really highlights the necessity of being an active advocate for your own health. You have to find a practitioner who doesn't just brush off your medical history in a rush to sell a treatment.
Absolutely.
Now, beyond the fish allergy debate, our sources list several other hard deal breakers for this treatment. Obviously, because this is fundamentally an animal-derived product, it's contraindicated for anyone adhering to a vegan or vegetarian lifestyle.
Right. Furthermore, it is universally contraindicated for pregnant or breastfeeding women.
Just a lack of data.
Yeah, there is simply a total lack of clinical safety data regarding how these biostimulatory DNA fragments might affect fetal development or transfer through breast milk. So the medical community universally avoids treatment in this demographic.
That makes sense. I also noticed active skin conditions were frequently highlighted in the clinic guidelines. Which is funny, because since the entire purpose of the treatment is to heal and repair the skin, I initially assumed someone dealing with a massive acne breakout would be the perfect candidate.
It's actually the exact opposite.
Really?
Yeah, active skin infections or acute inflammatory conditions in the target treatment area are absolute contraindications.
So like a flare-up of cystic acne.
Cystic acne, severe eczema, uncontrolled psoriasis, or a viral infection like herpes simplex. Treating them is highly dangerous. Puncturing the skin barrier repeatedly with a needle in an area of active infection can inadvertently spread the bacteria or viral load deeper into the dermal layers.
Oh, wow. So severely compromising the tissue rather than healing it.
Exactly.
The text also extensively covers autoimmune diseases.
And the reasoning there connects right back to the core mechanism of action. Polynucleotides are biostimulators. Their primary function is to intentionally provoke an immune and cellular response to trigger healing cascades.
Right, so administering a biostimulator to a patient with an uncontrolled autoimmune disease means you are actively signaling an immune system that is already overactive.
Yes, or one that is aggressively attacking the body's own tissues. The resulting inflammatory cascade can be entirely unpredictable.
That sounds incredibly risky.
It is. Additionally, patients utilizing blood-thinning medications like warfarin or high-dose NSAIDs require careful medical assessment. The procedure involves dozens of microinjections that could lead to severe, prolonged hematomas.
Okay, so understanding this meticulous screening process naturally leads us to the actual physical reality of the treatment for those who pass the test. Because the physiological response we've been describing, the active cellular signaling, the induced regeneration, sounds inherently disruptive.
Oh, the clinical experience is entirely different from what most people expect.
Like, this isn't neurotoxin where you walk out and a few days later your muscle movement simply stops.
Yeah.
You really have to set your expectations right.
Definitely. Unlike traditional dermal fillers, which offer the instant gratification of physical volume, polynucleotides demand significant patience from the patient.
How long does it actually take?
The timeline relies entirely on your body's endogenous cellular turnover rates. The clinical data indicates that visible results take 2 to 4 weeks to even begin manifesting.
Oh, wow.
A patient might notice a slight early improvement in skin texture purely from the initial hydration effect, but the true structural changes, the neocollagenegenesis and elastin production, they require sustained cellular effort, typically peaking around the 3-month mark.
And the texts consistently detail that this is rarely a one-off procedure, too. The standard protocol requires a dedicated course of treatment, usually 2 to 4 sessions, spaced roughly 2 to 4 weeks apart.
Right, because you're essentially trying to coach aging or damaged cells to behave like highly efficient younger cells. That requires repeated biochemical signaling to sustain the fibroblastic activity over time.
So what does this all mean for the immediate aftermath? You're sitting in the chair, the practitioner uses a fine needle or a blunt-ended cannula to deposit the gel into the superficial or mid-dermal layers. What actually happens to your face the moment you stand up?
Well, reading through these clinic guides, you are definitely not walking out looking ready for a social event.
No.
No, this is a medical procedure involving controlled trauma to the tissue. The most common immediate physiological responses are localized redness, swelling, and bruising.
But uniquely with polynucleotides, due to the superficial injection technique often utilized, patients experience these small raised bumps at every single injection site.
Yes, clinically referred to as papules or blebs.
Blebs. Based on the descriptions, it essentially looks like you lost a fight with a swarm of mosquitoes. You walk out with a highly visible grid of tiny bumps across your entire face.
It looks intense, but those blebs are a standard expected part of the integration process. They typically resolve rapidly, usually flattening out within 12 to 24 hours as the viscous product diffuses and integrates into the surrounding dermal tissue.
Okay, so that's not too bad, but those are just the common, mild physiological responses. We really need to look at the more severe complications mentioned in the clinical literature.
Sure. If we connect this to the bigger picture of aesthetic safety, we absolutely must acknowledge the rare but serious adverse events.
Right.
Now, the overarching data shows polynucleotides have an excellent safety profile, with sources citing over 1.8 million documented uses. But anytime you breach the skin barrier and introduce a foreign compound, things can go wrong.
Yeah, the medical SPA-RX and Dr. Medica sources specifically highlight the risk of nodules or granulomas.
Yes. A granuloma is a firm subdermal lump. It occurs when the body's immune system identifies the injected material as a persistent foreign invader that it cannot easily break down.
So it traps it.
Exactly. Macrophages surround the material and wall it off, creating a hard, localized inflammatory nodule. This complication can be triggered by improper injection depth, like placing the dense product too shallowly in the tissue, or by a prolonged, dysregulated inflammatory response from the patient's immune system.
And here's the scary part. Unlike hyaluronic acid fillers, which can be rapidly dissolved in an emergency using an enzyme like hyaluronidase, you cannot simply dissolve polynucleotides.
No, you can't. That lack of a reversal agent changes the risk profile significantly. If a granuloma forms, managing it is extremely complex. It may require potent anti-inflammatory medications, localized steroid injections to break down the immune response, or simply a vast amount of time for the body to slowly resolve the nodule on its own.
Which sounds miserable. There's also the constant risk of infection, which just underscores why navigating this in a highly qualified medical-led clinic is so vital. You are breaking the skin barrier dozens of times in a single session.
Right. If the clinical environment lacks rigorous sterility, or if the patient's aftercare protocol is poor, aggressive bacterial infections can take hold deep in the dermis.
And we must also discuss vascular occlusion. The risk is considered lower with polynucleotides compared to highly cohesive, thick dermal fillers, right?
It is lower, yes. However, anytime a practitioner is injecting a gel-like substance near the incredibly complex vascular network of the human face, especially in the delicate periorbital region around the eyes, there is a risk of inadvertently depositing the product directly into a blood vessel.
And that blocks vital blood flow, literally starving the surrounding tissue of oxygen.
Exactly. And if not immediately identified and managed by a medical professional, it can lead to devastating tissue necrosis.
Which is exactly why attempting to get this treatment done at a casual high street salon by someone who took a weekend injection course is incredibly dangerous. The anatomy of the facial vascular system is wildly complex.
You need a practitioner who fundamentally understands injection depth, facial anatomy, and how to aggressively manage a severe complication the second it arises.
Thankfully, the regulatory landscape is actively trying to catch up to this reality. Evidence submitted to Parliament by organizations like the British Beauty Council and the Joint Council for Cosmetic Practitioners highlights this exact danger.
Yes, they are urgently pushing for statutory regulation and mandatory licensing to ensure that high-risk injectable biostimulators are only handled by properly trained medical professionals.
Man, we have covered a massive amount of clinical ground today. Let's do a quick wrap-up. Polynucleotides represent a profound leap in regenerative medicine. We are utilizing highly purified, fragmented fish DNA to biohack the skin's aging process from the inside out.
It's incredible.
It really is. We are actively signaling our cellular factories to build new collagen, elastin, and vascular networks, rather than just filling in the superficial gaps with synthetic gel.
It's a fundamental philosophical shift in aesthetic medicine, moving away from temporary visual camouflage toward achieving true, sustainable cellular repair.
But, as we discovered with the great fish allergy debate, while the enzymatic purification process makes the compound theoretically safe for most, the medical community remains divided on the absolute limits of that safety.
It proves that as a patient, you must act as your own investigator. You have to thoroughly disclose your medical history, request patch testing when necessary, and understand the vital distinction between a mild biological sensitivity and a severe contraindication.
Yeah, absolute transparency regarding your immune history and underlying health conditions with your practitioner is completely non-negotiable when dealing with biostimulators.
Definitely.
So for you listening, whether you are actively researching clinics to book a consultation for some stubborn acne scarring, or you simply love staying informed on the absolute cutting edge of medical science, the key takeaway from our source stack is pretty clear.
True aesthetic medicine is rapidly abandoning the era of temporary synthetic cover-ups. We are fully entering the era of biological regeneration.
Yes, the focus is now entirely on delivering the precise biological signaling tools the body requires to heal its own structural deficits.
Which is fascinating.
It is. And it leaves us with a pretty wild thought to end on. If aesthetic medicine is shifting so dramatically away from synthetic fillers and moving toward treatments that fundamentally alter our cellular behavior using cross-species DNA,
Yeah.
what does the future of anti-aging actually look like? Will we eventually abandon the concept of trying to fill in our wrinkles entirely and instead rely 100% on marine genetic blueprints to teach our human cells how to simply never age in the first place? It's something to think about the next time you look in the mirror.